Good morning, Julia. Happy New Year.
And a very happy new year. Although it's not going to be a happy new year for millions of secondary school pupils who you are going to force to wear face masks all day. Why?
Not for a day longer than is necessary. Obviously, we introduced face masks in communal areas before the holidays because of the Omicron variant. And it's one of a series of measures because my priority has to be to keep children in school with their friends, in classes, learning with teachers. So the absolute focus, and I remember before Christmas, I had a call out to retired teachers, anyone who's come back to the profession. A number of my colleagues, Jonathan Gullis, Caroline Ansell came forward, Michael Wilshaw came forward, a number of staff in my department have come forward. So workforce is important. Obviously, testing this coming week is important, and I, before Christmas, made sure we had enough test kits for schools to conduct the testing.
Can we come back to the issue of masks?
Sure.
Mr. Zahawi, you said not for a day longer than necessary. What evidence do you have that it is necessary for children to wear face masks at school at all, let alone in the classroom?
Yeah, no, absolutely. I mean, that's the right question to ask. So UK Health and Safety Agency have recommended face masks just because Omicron is so much more infectious. The SPI-M data on this, and of course, my department conducted an observational study end of last year, which in the next sort of 48 hours we will publish, looking at 123 schools that actually used face masks. And, of course, evidence from the US, from Germany. The reason I say not for a day longer is because I know, obviously, the impact of on learning, because it's not ideal wearing face masks, to say the least. But if the option is to have more children in school and Omicron out of school, then I think it's a sensible thing to do.
With all due respect,
It's
the second time I've asked you, sir, what is the evidence? We constantly are told, oh, well, this agency has recommended this person has recommended this. What is the evidence, and will you publish it? Because we've got numerous countries around Europe that have had face masks in schools for a long time, seeing rising Omicron cases. We know that COVID, even the first nastier version, barely affected children. We know that Omicron is a much milder version. I've got it right now, which is why I'm talking to you from home. It feels like a rotten head cold, but frankly, it's not enough to stop the entire country. But we never get to see the evidence. Now, the likes of Professor Russell Viner, he's an advisor on SAGE, he's the president of the Royal College of Paediatrics. I'm going to guess he knows what he's talking about rather more than I do. He says the evidence on masks is very unclear. He says we don't have the evidence that this is useful. So what evidence have you got that apparently the Royal College of Paediatrics president doesn't know about?
Well, I've just said to you that we've conducted a study at the end of last year, an observational study, I have to caveat that, which we will share the evidence with Parliament and, of course, with the country, looking at about 123 schools that actually had face mask policy in the classroom. And, of course, the UK Health and Safety Agency's recommendation on this. And, of course, from other countries, look, let's it's not ideal. This isn't a respiratory disease that's aerosol transmitted, right? If you are a carrier of the virus and you are asymptomatic, wearing a face mask will stop other people being infected.
Well, actually, there isn't very much evidence for that statement at all.
Just hear me out a second, right? All these interventions are imperfect, right? The most important intervention that we know works is the vaccination program and the boosters, right? And that's why with 34 million boosters, when the Prime Minister challenged the system before Christmas, we've delivered almost 10 million additional boosters. That's the right thing to do. We don't want to see secondary school pupils wear face masks a day longer than necessary. But if it helps us keep more children in school, in education, it's absolutely the right thing to do.
So you've got this evidence. So I'd like to know what quantifiable impact have you got from all the evidence you're claiming you've got, which we've not seen, and the president of the Royal College of Paediatrics hasn't seen? What quantifiable impact will masks in the classroom make? How many more children will be kept in the classroom than would otherwise not be in the classroom? I mean, I want to see some actual clear evidence before children are forced to wear a face mask all day, which, by the way, you're not going to be wearing a face mask all day. I'm not going to be wearing a face mask all day. Most of the parents of these children won't. But the children who are most least affected by COVID are going to be forced to do that. So what quantifiable impact? How many fewer children will miss school or will get COVID as a result of this measure? Do you know?
Well, first of all, you mentioned you and I and parents who, of course, are not being asked to go into work. They're being asked to work from home wherever possible. That's a big difference. We want children to be in school. And so the impact, whether it is 10%, 15%, whatever it is, surely it has to be better, Julia.
What is the figure? I'd love to know what the figure is.
Well, I'm saying to you, so look,
do you know what the figure is?
So I've done some observational work in the department that says that the impact is material, that we should offer it as
and what is that material impact?
So we will in the next 48 hours we'll publish it and share it with Parliament, and then you can have a look at it. I'll come back on your programme and talk about it, Julia.
Okay.
But the right thing to do is for tomorrow to thank teachers and support workers, because 99.9% of schools were open before Christmas. I want to make sure we get schools open, get kids back in school, and be sensible and pragmatic and proportionate about these things, rather than
Isn't the reality? This is just the appearance of doing something. This is a sop to the National Education Union and others.
No, Julia, this is absolutely not. This is about being proportionate, pragmatic. I'm also, by the way, just so that you know where I'm coming from, because I am the evidence-led Secretary of State, is how I describe myself, commissioning research to look at the impact of masks on children in school, because actually we need to learn that lesson, because we know that it is challenging to be in school wearing a mask. So I'm not just looking at it currently with the current challenge, but also for future lessons learned is also important.
Okay. Let's also talk about isolation periods. That's a very big issue for a lot of people right now. France and other countries, I think America, have moved to a 5-day isolation period for those who test positive for COVID. We're still on 7 days, but only once you've got 2 lateral flow tests that are negative. Realistically, with the pressure on staff absences in the NHS, in care homes, public transport, and many other key sectors, is it time to move to a shorter isolation period?
So the UK Health and Safety Agency have done a really good blog on this, looking at this exact question, and they absolutely end by saying they'll keep it under review. But the difference is, in the UK, you're asked to self-isolate when you get symptoms. In the US, you are asked to self-isolate once you've got a positive test, and therefore we're not comparing like for like. The blog essentially says that the danger of moving to 5 days is you actually could increase infection rates. The sensible thing that we have chosen to do is you test on the 6th and 7th day, and as long as you're negative on both those days with a lateral flow test, then you can come out of isolation. But there's a very good blog that your listeners and viewers should look at from the UK Health and Safety Agency on this.
Okay, just finally, I must ask you, we had a bet last July. I bet you that we would be in a version of lockdown by the end of the year. You bet me we wouldn't. I foolishly bet you £1,000 to charity. You won that bet, and I have to say, I'm absolutely thrilled about that, Nadhim Zahawi. We're going to make some suggestions and ask people on Talk Radio to suggest which charity should receive that money, maybe split it between a number of different charities. Any charity you could suggest would be deserving of that cash?
I'm grateful to you for remembering the bet and honouring the bet. And like you, I'm also delighted that I won the bet and not you. I'd love you to give as much of the money as possible to the Shakespeare Hospice in my constituency, because I think none more deserving than the Shakespeare Hospice. And if you can consider them as part of your distribution of the £1,000, I'd be delighted.
Okay, Nadhim Zahawi, really appreciate you coming on. Really looking forward to seeing that evidence. We'll get the likes of Professor Carl Hennigan, who's on the show later, to perhaps go through that evidence, and lovely to get you back on again afterwards to discuss that. Thank you very much indeed for joining us here at Talk Radio.